Good afternoon, everyone. Welcome to our Kern County Emergency Medical Care Advisory Board meeting of August 13th. At this time, we will call the roll.
Tyler Weitzel.
Here.
John Surface.
Here.
Sheriff Youngblood.
Here.
Supervisor Flores.
Here.
Dr. Lyon.
Here.
Orchel Cryer.
Here.
We have a quorum.
Thank you. That brings us to our flag salute. Dr. Lyon, would you please do us the honors? Thank you.
Stand. Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, at this time, we'll do the consent agenda. All items listed with CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda and it will be considered in its listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. Okay. At this time, I'll call for the motion.
So I think, just to make a comment, consent agenda item number 10 is a Maddie fund release request, and it's for the hospital authority, so I will need to recuse myself from that. But I believe that gives us an issue with quorum on that one item.
Yes, sir. Mr. Chairman, that with him recusing himself, we no longer have a quorum for that item.
Okay.
So I'm going to request that that item be pulled and that it be placed on the next agenda item.
Sure. Okay. Do we have to vote on that to be pulled?
I believe without the quorum, I don't believe we have to vote on that. No, we check with county council.
Yes, you need to vote on moving it to the next agenda.
Okay.
So then I would make a motion to place this item on our next MCAB meeting.
Second.
Okay, all in favor?
Aye.
Aye. Opposed? Okay, motion carries. Thank you. And then I'll also now entertain a motion on approval of the consent.
Motion on consent.
Thank you. Okay, all in favor?
Aye.
Aye. Opposed? Okay, motion carries. Okay, that brings us to public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on the agenda but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask questions for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please spell and state your name before making any presentation. Is there any members of the public for a public presentation? Okay, seeing none, that brings us to board member announcements or reports. Okay, seeing none, that brings us to our Emergency Medical Services program request, and I'll refer to Mr. Ferris for item 3, manager's report.
Thank you, Mr. Chairman. Kern County EMS continues to focus on system performance, ambulance availability, appropriate resource utilization, hospital patient offload, and emergency preparedness. The EMS program has implemented the 2024-25 Emergency Medical Dispatch Study and is conducting a comprehensive review of the compliance of those determinants and the resources assigned to 911 medical calls. The program is also developing ongoing quality improvement tools to monitor compliance with the revised DMD response assignments, response utilization, lights and sirens use, and response time performance for all agencies. EMS continues to expand its data analysis capabilities for monitoring ambulance response time compliance, hospital offload performance, dispatch practices, and system resource utilization. New reporting and quality improvement tools have been and are being developed to allow the program to identify individual responses requiring review while also evaluating larger system trends by provider, response priority, EMD determinant, hospital, and geographic area. These efforts are intended to support data-driven policy decisions while maintaining ambulance and first response resources for incidents where they provide the greatest benefit. The EMS program continues to maintain its emergency preparedness responsibilities, including coordination of medical and health resources during disasters and significant incidents. The emergency preparedness team is working closely with Kern Medical to assist them in becoming a Level 2 Special Pathogens Treatment Center. Additionally, we are working on the creation of a highly infectious disease personal protective equipment training program for all field providers. The EMS Emergency Preparedness Warehouse remains an important component of this capability by providing centralized storage of medical supplies, equipment, and other resources necessary to support Kern County's response to emergencies and disaster declarations. For the remainder of 2026, the EMS program will continue to focus on improving ambulance patient offload performance and ambulance availability, continuing the EMD response configuration review, strengthening ambulance and first response time quality improvement, expanding data-driven monitoring of overall EMS system performance, and maintaining medical and health emergency preparedness capabilities. The overall objective remains to ensure that Kern County maintains an EMS system that is clinically appropriate, operationally efficient, data-driven, and capable of placing the right resources on the right calls while preserving emergency resources for the patients who need them the most. That concludes my report. I'm available to answer any questions.
Thank you, Mr. Ferris, for the manager's report. Any questions or comments for staff? Okay, thank you. This is a receive and file, so I'll make a motion that we receive and file.
Second.
Thank you. Motion second. All in favor? Aye. Opposed? None. Motion carries. Thank you. Now that brings us to item 4, APOT Task Force report. Mr. Ferris, will you be giving this one as well?
Thank you, Mr. Chairman. Yes, unfortunately, Bryn had a conflict and she's not able to be here, so I just have a brief statement to read regarding ambulance patient offload times. The ambulance patient offload times remains a major system priority. The EMS program continues to closely monitor hospital performance with the goal of achieving the required 90% compliance with patient offload within 30 minutes. We have seen measurable improvement at several receiving hospitals during 2026, with multiple facilities achieving or exceeding the 90% compliance standard during individual day and night shifts. In July, we reached an important milestone when Kern Valley Healthcare District became the first hospital to achieve the 90th percentile standard for an entire month with 91.33% of ambulance patients offloaded within 30 minutes. To further support improvement efforts, the EMS program began providing daily APOT performance reports to hospitals that requested them. These reports include each hospital's month-to-date performance as well as results from the previous day's 2 operational periods, 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. Breaking the data down by shifts provides hospital leadership with a clearer picture of when offload delays are occurring and can help identify staffing, workflow, and operational issues contributing to those delays. EMS continues to work directly with hospital leadership to identify successful practices, address periods of poor performance, and reduce the amount of time ambulances remain unavailable while waiting to transfer patient care. Improving APOT not only improves patient flow, at receiving hospitals, but also helps ensure that ambulances and EMS personnel are returned to service as quickly as possible to remain available for the next emergency call. That concludes my report. I'm available to answer any questions.
Thank you, Mr. Ferris. Any comments or questions regarding the APOT task force report? Okay, seeing none.
Motion to receive and file.
Thank you. Second. Okay, all in favor? Aye. Opposed? None. Okay, motion carries. Thank you. That actually brings us to item 12, adjournment. The deadline for submitting public requests to the next MCAB meeting is Thursday, November 5th, 2026 at 5 p.m. to the EMS program manager. And so at this time, we will adjourn to November 12th, and I'll just request a motion to adjourn. Thank you. We're adjourned. Thank you.